Hello everyone. This video is aimed at undergraduate medical students of BJ Medical College, Ahmedabad. So this video is about what are electives and how are they going to be allotted. So this video has two parts. First part is what are electives. I'll explain to you what electives are. And second part would be how are they going to be allotted to all of you. So the part one is what is elective. Now this word is came into our vocab once CBME, that is competency based medical education, was introduced with the batch of 2019. So if we let's just look at what is an elective, then you can say that elective is akin to a posting, like a posting. So what is a posting? So when you come in second year MBBS, you have clinical postings, right? You go to medicine, Department of Medicine, Department of Surgery, and so on and so forth. Now those postings are fixed and all of you rotate through fixed number of postings. So the same way, elective is also a particular posting. But this posting is not a buffet, like fixed for every student. No. The elective is fixed, but the topic of the elective can be different between students. So the way after your 12th, you appeared for NEET exam and then you got your admission in MBBS based on counseling, based on some merit and based on some system. The same way, there are fixed number of seats in each department in BJ Medical College for electives, and they are all available, but they will be allotted as per your choice and merit both, right? So there are two electives. First elective is known as block 1, which is in the subjects of pre and paraclinical, and second is known as block 2, which is in clinical subjects. So both of these electives are 14 days each and defined as it's a learning experience created in the curriculum to provide an opportunity for the learner to explore and discover certain specific areas of interest. So depending on which batch you are on, it can be that both the electives are taken at the end of third year part 1 MBBS and beginning of second year the third year part 2 MBBS. So between the first and second part of the third year, both of them are there, or it can be that one elective is at the end of second year and the second elective is at the end of third year first part. So for block 1, that means electives in the pre and paraclinical subjects, the timings are usually after clinical posting, which means that your clinical postings will go on during that time, during those electives. But during clinical electives, which means block 2 electives, all the clinical postings would be suspended, which means you will not have any clinical posting during that time and each student will be going to a specific elective only. So 4 weeks total, 2 weeks each, block 1 and 2, pre-para and clinical. Now we come to the, as I just now said, part 2 of the elective. So now you know that elective is a posting. It's going to be 14 days each. Each one of you will have 2 electives. You will be able to choose the way you appeared for counseling after your NEET exam in 12th. And that is how you got allotted your medical college. The same way, you will be filling out a form and you will get your elective. So how are they allotted? So it also has two parts. Let's talk about the first part. So block 1 and block 2. Block 1 is pre and paraclinical and block 2 is clinical elective. So block 1, in total there are 28 electives. So block 1 are, you can imagine all the subjects which are first year subjects, which is anatomy, biochemistry and physiology, second year subjects pathology, pharmacology, microbiology, forensic medicine, etc. So all these 6 or 7 subjects in total, they are offering electives on 28 topics. And the same way in clinical branches, all clinical branches combined, they are offering electives in 43 topics. Now each elective would have intake of 3, 4, 5 or even up to 10 students. That is a different thing, right? So each elective would have more differing number of seats for that particular topic or elective. So there are two parts to you choosing or you being allotted a particular elective. The first part is we have created something known as a booklet. It goes by the name of Handbook on Electives. It's a PDF file and it will be shared in your WhatsApp group, your batches WhatsApp group. You will get it. I'll just show you what it looks like. Now, as it is a handbook on electives, each page of that handbook carries the details of one elective. So it is like, as if you are looking at a list of medical colleges after your 12th. Like one page details one medical college, namely that this medical college is located at this place, and these are the student strength and how old it is and what you can expect from that place. The same way, this booklet details one elective per page. So that is how you get to know what to expect from if you get that particular elective, right? So what's on offer on that elective, right? So the first part is there is a handbook, PDF format will be shared on your group. You will have time to go through the entire handbook and choose for yourself in what order do you want to fill out the form of choices for both block 1 and block 2. Okay? Second. So this I am showing you a sample page from that booklet. So consider this one page of that booklet. It says that there is it's a block 1 elective. We have coded each elective. So it says that the code is PH03. It is offered by Department of Pharmacology. And the topic of this elective is biomedical research and scientific writing. Then it says that what are the objectives of the electives, which you can read. And then there is a brief description of that elective, like what it's really about. And finally, there are total seats for that elective, which are 10 for this particular elective, right? So this is one page. So there are, the entire handbook has details of each elective for offered in block 1 and block 2 both. So if you look at this one, then this is a sample page from block 2 elective. So the code is SU01. It's offered by Department of General Surgery and it's about basics of surgical suturing. And then you can look at the objectives, then description, and finally what is the total number of seats, right? So once you have seen the entire booklet and listed out your preferences on a piece of paper, you can just maybe jot down the code number, which would be easier for you to remember and maybe jot down. And the next step, once you have done that, the second step is going to be filling out a form, or simply put, filling out or giving in your choices, preferences, right? So we are going to collect those choices on an online form, okay? So this is a QR code which you can scan and get to the mock form. Now please remember, this is not the final form. This is only a mock form for you to practice and know that this is how the actual form is going to be. So you may just scan this QR code. If you're watching this video on a cell phone, then you can pause it and ask somebody else to scan from yours and you can do the same. But your final form will be almost a replica of this particular form that you will get to after you fill in this. So once once you have read the note list, read the booklet, you have listed out the preferences, you scan this code, go to a mock form, you fill it out only for an experience. Then what's going to happen is I am going to share the actual form for your preferences in your batches WhatsApp group. It will be open and it will be accepting responses for a specific period of time, right? Once that time is over, we will stop accepting responses. Depending on all the responses received, within maybe few days, we will then give out the entire list of who has secured which elective, right? So just like your counseling after 12th and after, even after your MBBS and everything, this is the way counselings happen, you know that. So that is what is to be done. So essentially, if I have to summarize all I said was, it's a posting. There are many on offer. Each such elective posting or elective would have many seats. You get to know the electives if you go through the booklet. Once you go through the booklet, you can scan the form. You can fill in the responses, which is a mock form. Afterwards, you will get the link for the final form. And once you fill in that, your job is done. Then we will give you the final results. Okay. I think that is it for the video. Thank you so much for your